The thousands of people working both here at the Great Western Hospital and out in the community are a huge part of Swindon and the surrounding areas. This hospital may have only been here for 20 years, but it served hundreds of thousands of people, helping people at every stage of their lives. This year, we are proud to be celebrating 75 years of the NHS. Journey back nearly 2 centuries, and the origins of public healthcare in Swindon began with the Great Western Railway Medical Fund. Selected as the hub of the locomotive works for the Great Western Railway in 1847, the society was created to look after the railway workers living in the new Swindon Railway Village. Money was deducted from employees' wages to fund the society, which in its early days saw staff and their families provided with a doctor who they could see for no extra fee. As the local railway began to grow, so did the fund's provisions, and would eventually include a swimming pool and Turkish baths. In 1873, the Great Western Railway Medical Fund Hospital, or the Great Western Hospital for short, was opened, one of the first places in the country to have hospital care open to all its workers.
Most of the population, the working population of Swindon, were employed in the GWR. So the inhabitants, especially those, had to pay extra to be covered and cover their families. How they paid for it, it cost 1 penny per week for a family to be covered. Halfpenny for a single man or just a man and his wife. So it seems very cheap now, but obviously that was the going rate back in the day.
In the early 20th century, the UK would become impacted by war, and Swindon was not immune to that. Hospitals would be used to care for those injured by war, with huge numbers of casualties returning from the front line. At that time, the government decided to create a form of public health service. Using the model of the Great Western Railway Medical Fund and other medical funds across the country, they created a system of national insurance, which was used to fund the early years of the National Health Service. Without schemes like the one built right here in Swindon, the NHS as we know it today may not exist.
So the idea of general public paying money into a fund to pay for healthcare is what evolved out of the changeover, and it's what we know today. I think the medical fund and the NHS as it became are something this town could really be proud of and should be proud of.
As the NHS was born, care in Swindon across the early years was provided at hospitals across the town. That would last until the Princess Margaret Hospital was born. It was the first hospital to be purpose-built by the NHS. The Princess Margaret sat across a 20-acre site, and it was named after Princess Margaret, who laid the foundation stone. Over time, it would expand with a school of nursing added, and as Swindon grew, so would the hospital that cared for its people. For more than 40 years, the hospital would be at the heart of the local community. Eventually, as Swindon continued to grow, the Princess Margaret could expand no more. The hospital would be taken down more than 40 years after Princess Margaret laid the foundation stone. A new hospital was built, the Great Western Hospital that we know today. A huge move took place with services transferred and residents having to find their way around the new hospital. Services began in 2002 with the Duke of Edinburgh following in royal footsteps by opening the site in February 2003. Since it was built, the Great Western has grown to accommodate the needs of Swindon. New teams have been welcomed to join us, including community teams, and we also have our trust charity Brighter Futures. We're one of the first places in the world to offer the COVID-19 vaccine and have opened new units like the White Horse Birth Centre in that time. Our continued growth has seen us recently add to our services by developing this brand new urgent treatment centre that you see behind me. We've also opened a radiotherapy centre run by Oxford University Hospitals Trust, which means we can treat cancer patients closer to home. And the work isn't stopping either. We've bought land, which means that as Swindon and the surrounding areas continue to grow, so can we. We're also expanding our emergency department, which means that we will be able to deliver better care to all of our patients.
The new department is going to be much bigger. It will be much nicer with more capacity. Patients will have more privacy in terms of bigger cubicles with more isolation.
Well, it's really exciting. We'll get a larger footprint ED, we'll increase the capacity of our resuscitation room, and in addition a separate paediatric resus, so that's much more facilities than we've got already.
What the new Children's Emergency Unit will do is bring together all acute and emergency paediatric care into one purpose-built space. This will mean that staff teams can work more closely together, it will be more efficient, and it will help really ensure that we're providing high quality care to everyone who comes through our doors.
As we celebrate 75 years of the NHS, we can draw a line between the actions of people 2 centuries ago through to the modern day. From railway workers and the perils of war through to new hospitals, the development of modern technology and the pandemic, the work of healthcare workers in years gone by inspires us today. Working with their legacy, all of us here at the Great Western will be there for our local community to provide all the care you need for the years to come.